Hello, everyone. For those that have joined, we're just waiting for the advisory group members to join as well. But it looks like we have a growing crowd of attendees. Um, and then we have some of the HCA staff online as well.
Okay, it looks like we got Jim on. How's it going, Jim?
I wonder why this meeting's on the hottest day of the month. Like, could we have it outside, maybe, at least?
Yeah, we can go do it, host it at a water park. Okay, I think we're just waiting on some more of the advisory group members here. It sounded like Dario was maybe having some technical difficulties.
Yeah, I just sent over another email with the link. Hopefully that works.
Hi, sorry, I figured it out. Yeah.
Hi, Dario.
No,
Sorry about that.
hey,
Um,
no, my my error, I think. Appreciate that. Can you hear me?
Yep.
yep.
Okay. Sorry, just could not find the right link.
Okay, give it just a couple more minutes. Okay, we got Tim. And who else were we waiting on here?
Okay, I think we have 4 out of 5 of the advisory group members, and one, Laura Berry, mentioned that she could not make this meeting. And so I think we can go ahead and get started, Mike, if you'd like, and I'll share the agenda again.
Perfect. Great, thank you very much. Okay, yeah, appreciate everyone's time coming out here and meeting today. We had a good board meeting here last month where we selected a number of drugs for drug review. And so now we're working on moving into the next steps. And so one of the things we wanted to do was circle back with our advisory group here and talk about some of those next steps and where we're going from there, and just kind of give everyone an update on some of the things that we're working on, and get feedback specifically from the advisory groups in terms of how they're going to work with us as we're moving through the drug reviews and the next steps. So as most people know who have been following the meetings, we did pick 4 drugs here during our July board meeting. And we're going to prioritize 2 first, as this is going to be our first round of drug reviews. And so working on those, and then as we have time, or if we have time, working on the other 2 on the end, once we've got some of our processes down a little bit more and things are streamlined. So Enbrel and Standy are our first 2 drugs that we're going to be working on. And so additionally, as part of the advisory group, one of the things we're going to be doing is then, per legislation, expanding the advisory group with some specialists who are related to, have some sort of interest or specialty related to those 2 specific drugs. And so yeah, that's kind of where we're at and where we're going. And so Simon will go in here. Our next thing we're going to be talking about is a little bit more about the recruiting for those members. Then after that, Marina is going to chat about some of the patient surveys and forms that we've been working on. And then finally, we'll kind of wrap up with discussing how the advisory group will work on and contribute to the affordability review. So we do have a few things on our agenda, but I don't imagine us needing to take the full 2 hours unless some people just really, really want to. So I'm happy with if we talk and say all we need to say and figure out our next steps, we can wrap up early. So any questions on that before we kind of get kicked off into the main part of the agenda? Okay, great. Well, so Simon, do you want to talk a little bit more about the advisory board and kind of next steps with that?
Yeah, I'd be happy to. Hey, everyone. So if you'll recall from when we had started recruiting for the advisory group, the advisory board that you're on, we had discussed there being a core advisory group, which is stable and they have a certain term, but they'll oversee multiple affordability reviews. And then having a supplemental advisory group, which are patients, patient advocates, or providers that are specific to the drugs or the illnesses that those drugs treat. And so what we've done is we've opened up the application for a supplemental advisory group for the first 2 drugs, Enbrel and Xtandi. And so far we've received 3 applications, 2 from clinicians and 1 from a patient. More applications roll in, and then from there evaluate and communicate out to those folks if they've been selected or not. Really, the selection is making sure that there are no conflicts of interest. And I'm not sure if my camera is being odd for those who can see, but it's kind of flashing on my end, so I'm going to turn it off quickly just to make sure it's smooth. But anyways, then we'll reach out.
Sorry
Oh,
to interrupt.
yeah.
Can you repeat? You were cutting a little bit. Can you say there was a patient or a patient advocate who had applied?
Yep, it's someone who has been living with rheumatoid arthritis and then is also involved with kind of an arthritis patients advocacy group. So it's, I'll go ahead.
And they're living in Washington?
Yes.
Great.
Yeah. And then the other two are clinicians, an oncologist who's also the medical director of a cancer care unit, and then a clinical oncology pharmacist. And so probably, as I mentioned, you take the next 2 weeks, see if more applications roll in. If not, 3 plus, 1 or 2 additional, if they come, would be a great size for the supplemental advisory group. And we'll have them slot into these meetings as well, and then work with you all to determine exactly how do you want to use their expertise or their experiences to inform your thinking and whatever output you give to the board.
And can you say again how, other than the mailing list mail that went out, are there other ways that you've circulated this yet?
Yep.
The
So
application.
So as you mentioned, the mailing list is posted on the website, and then we reached out to, I believe, you all as well as the PDAB board to have you circulate with your networks. We reached out to other states that we work with to NASHP, to Portal, and then we've just asked folks, anyone in their network, to share with them as well.
Have you considered reaching out to the medical societies in Washington?
That's a great idea. I'll add that to our outreach, and genuinely any ideas that you have, shoot them my way, and we'll send them to them, because really as wide a net as we can cast, the better.
Great, Tim.
Yes, Simon, I also might suggest the Washington State Pharmacy Association, Jenny Arnold, as a good point of contact to see if there's people within the pharmacy realm that would want to participate as well as clinicians.
Great. I'll reach out to them as well. Any other thoughts or questions? Great. If not, I can pass along to Marina to discuss next steps around the patient and patient advocate surveys. And Marina, also, if you want me to keep talking, or if you want me to talk around that as well, just let me know.
Sounds good. Thank you. Let me share my screen here. Let's see. Is that coming up on your end?
Yes.
Okay,
I can see.
great. Great. I believe you all the board advisory group members received a copy from Simon by email. But I just want to go over what kind of questions we are hoping to include on the surveys, and just as a overview. So we have 2 surveys that will go out. One is targeting the patients and the caregivers. So that's one. And another survey is for the medical experts. So it's going to be 2 separate surveys. So the questions, languages are kind of similar, but totally well, similar concept, but the questions are not exactly the same, just because they are just different audience. And let's look at the patient survey first. So this is the one, and it's on a Word document right now, because when we build into our survey platform, we will have some kind of logic going on in the background. So depending on how patients answer on the earlier questions, some question may or may not appear if it's not relevant for that particular respondent. So that's why I'm just using a Word document, so that you get to see all the questions that will get into the survey platform. But anyways, the first one is just gonna be the cover page, thanking them for participating. And the first block of questions is gonna be about patient demographics, just asking their contact information to make sure, it's gonna be just one submission per patient. And also asking whether they're a patient or a caregiver, and what kind of conditions they have, in case a selected drug have a multiple indications, and I think that's going to be the case here. And then whether they're living in Washington or not. If they're living in Washington, what is your zip code? And whether they have any conflict of interest or not. And kind of household income information. And then the insurance information as well. So these are going to be all demographic questions. And then the next block is going to be about the utilization of the medications. So the first question is, of course, have they ever used the drug under review? Yes, no. And also we'll be asking if they've ever used any other medications to treat the same condition. Yes, no. And it's just the historical information, how long they've been using it. So this is asking more about their past and current medication use to treat whatever the indication the drug is approved for, or used for off-label reasons as well. And then the meat of the survey is here on the cost. So the cost questions, asking if they had any difficulty in terms of affording the medication. And we'll ask pretty much similar questions for the drug selected for the affordability review, and also some of the therapeutic alternatives here. And for the drug under review specifically, we'll be asking more detailed questions in terms of have they ever picked it up? So after the doctor has prescribed it, did they pick it up or not? Or they could be delaying picking up if they can't afford it, or maybe they're skipping a dose or taking a reduced dose or amount. And then more numerical responses. These are the questions for what is your monthly out-of-pocket cost, and what would be the affordable budget. So these are the questions, just trying to get more like numerical information. And then kind of similar set of questions for patients not taking the exact drug that's selected for the affordability review, but for potential therapeutic alternatives to see if their experience is similar or not. And then we'll be asking about their coupon use as well as the patient assistance program. So these are the questions we are hoping to ask, and then the survey will end with the free comment question. So this is going to be like open, text box that they can comment whatever they want to share with the board members. So this is kind of structure of the survey, and I think I'm still doing collecting feedback from individual board members, so it's possible that we'll have more edits, or but I don't think it's gonna be very different before we post this for public comment, so that we get to receive feedback from the public as well. But if our advisory group members have any specific suggestions, recommendations, I'd love to hear. And if you have like a bunch of recommendations or suggestions, written feedback is helpful for me to go through the edits. So if you can send it to Simon, that'll be most helpful. And should I stop here, Mike, and get some feedback if they have any like burning suggestions or recommendations at this point, or do you want me to go to the expert survey as well? What do you
Yeah,
think?
I'd say, you know, if there's some thoughts or comments, I see Daria's got her hand up. You know, because we provided the survey beforehand to give you a chance to look at it a little bit, so you know we're not just hitting everything cold turkey here. And then, as you know, Marina was saying, you know, we're still gathering feedback from the board members, so we wanted to make sure, you know, you guys had a chance to take a look and give any input should you you know, have something that you think would be important. And you know, we're trying to get towards brevity. I think that was, you know, some of the things that you know, for example, Hung mentioned during our last board meeting, is we want to keep it as short and concise as possible, but also still gather all of the data that we're looking for as well. So we're trying to balance a couple different things. So with that, Daria, I'll let you chat, and then if anyone else has some thoughts or comments, we can discuss it. Otherwise, we can move on and check out the other content as well.
Yes, thanks so much. I want to say contradictory things, and I know these two things are going to contradict each other, but want to echo the previous comments from the last meeting that it still is quite long, and that patients and providers, you know, may not have the time or the inclination to answer such long questions. So any more further trimming down would be good. That being said, I think there's things missing. And the first being more that gets to insurance hurdles. You know, what other committees hear from patients when they have public comments is a lot of people talking about insurance denials. Like I had to fight to get on this drug. I didn't take it because my doctor prescribed it and the insurance company, you know, wouldn't cover it, or they made me do step therapy. I had to jump through X, Y, and Z hurdles. And so I think that it would be good to somehow parse that out or include that. You know, you have a lot of questions that say because of cost, but none of them say, you know, something about because of insurance company. And that is going to be a lot of what patients are experiencing. It may be cost because of copays and coinsurance, but it may be they couldn't get the drug they needed, or they were delayed in getting the drug they needed because of insurance policies, insurance design. Next, I appreciate the questions differentiating between coupons, copay coupons, and patient assistance programs. They are hard for patients to know the difference between. I think you've done a good job of explaining what a patient assistance program, but might need more clarity in coupons. There are, you know, for example, patients get directed to websites or, you know, programs where they can buy a drug directly at a discount, in which case then they're not buying it through their insurance. They're buying it in a negotiated price. That's not a coupon. So they might think they got a coupon for the drug, but actually they're using GoodRx or, you know, a website like that. So that may muddle some of the data there. But that's very weedy. That's a very weedy thing to parse out. But I do appreciate the differentiation of the two. And then, yeah, my final comment was going to be about a public comment period for this. So appreciate you for both of these confirming that. Do you have an estimated timing for when you will post these publicly and seek comment from patient groups and provider groups and patients?
Yeah, so in terms of time frame, we're again trying to wrap up our internal reviews. So we have one-on-ones with the board members. And we've had some of them who have been out on leave, so trying to get their feedback while they're out and abroad and stuff like that. Is balancing that. So in terms of exactly when we're going to post them, not sure. Also want to make sure we give the advisory group some time if you all have some specific feedback. Obviously the sooner we can get that, the easier it is to incorporate it with the other edits that we're trying to make. And Daria, I think these were some uh, good things that you brought up as well. So I, appreciate, those points and insight. So don't have specific timelines on that right now, but looking to do it sooner rather than later, I guess. Okay.
And I
Any
think,
other? Oh,
oh,
yep,
I'm sorry,
Maria.
jumping in, but another area we need some help with the advisory group members is to kind of thinking about how to reach to the patients. So we'll be posting the survey once it's finalized to our website. But I believe we also want to do some more active reach out to make sure that patients know that survey is gonna be going on for the affordability review. So if you have any contacts or suggestions on how to reach patients of interest, that'll be really helpful. Yeah. Okay. So, any additional comments or?
Can I offer some thoughts on this? And I'm curious if we could get a little bit of information about how these drugs are typically acquired by patients to help inform this. For example, I know we're not doing Cabometyx right now, but even I guess Xtandi, if it's an episodic drug that the cancer docs are going to be working with, it's typically probably a different sort of experience for the patient than something like Enbrel that's ongoing, maybe actually kind of comes and fits and starts over the course of your condition, meaning you might switch between different drugs depending on side effects. And that might inform a little bit more whether or not like the a coupon is most commonly used or the patient assistance program or some other something, because I would echo the comments that this is really long and kind of unlikely, I think, to get a critical mass of data to be useful in its entirety. Um, so that's kind of one just general thought. And then also, I don't think there's a question in here about premiums. And I know that it's in here, it's like, how much is it? But whether or not you have trouble affording those, because obviously there's kind of a baked in piece of that. And that kind of gets me wondering if part of the shortening of this, if there could be a question overall of, do you have trouble paying for your healthcare? And if we can capture that data, that helps us understand, is it premiums, is it copay, is it insurance, etc.
Yes, yeah, I'm sorry, I forgot to mention, but yeah, we are asking about the monthly health insurance premium under the patient demographic block.
Right. But not the question of, do you have trouble paying the premium?
I see. Okay. So affording the health insurance in general then.
Yeah.
Great, thank you. Tim?
Yeah, I agree with the comments that have been made. I think it is a fairly long survey. What are we doing to get those that are visually or hearing impaired to respond to this survey? Because it's going to be a survey that's going to require that. So are we providing any access related options for folks?
I think that's something, Marina, we can chat about with the group that helps us put together the survey. I'm not sure
Yeah, so the agency
what they
has the
are.
survey. Yeah, so the agency has a survey team, and we have to ask their assistance in terms of making this into the platform. So the HCA goes through that specific, I guess, department or division to get all the survey approved for anything that goes externally. And I'm not sure what type of assistance is going to be available, but oh, I see Ryan is raising his hand. Maybe he has information.
Yeah, I do have a little more information. So yeah, so anything that we as an agency put out does go through an accessibility review. So, you know, it is tested on different types of screen readers for different types of people who have impaired or may have other types of accessibility issues. So there is that review that is done, that is through our comms team, but I don't know all of the specific details about what they do, how they do it, and to that point, how this may be different when it appears online. I just know that that is a step that goes through before we do post things to our website. And if you do want more information, we can reach out to the team that does that and get some information that we can then share with you.
Yeah, maybe along those same lines, just in terms of what's the reading age competency that this, because I'm looking at some of the questions that talks about gross net income. And, you know, some of our patients may not, you know, be able to work through that just in a survey tool. So is there going to be some assistance provided to people if they have questions on completing the survey?
Then I'm not entirely sure about. I do know that there is, you know, kind of a assessment on the reading level, but I don't know what the requirements are around, like if it has to be at like a 6th grade reading level or, you know, something like that. I think it depends on the types of documents that the agency produces. So if it's like a, you know, patient guide that is going out to our Apple Health population, I know that that has to be at a certain reading level, and some of the other documents that we write for, let's say, uniform medical plan may be different. So that is, I think, something we would need to research and also get back to you on.
Yeah, and we also tried to define some of the tricky things in the question itself as well. Like you mentioned, the gross income or the net income, we tried to put some definitions of what they are within the question to help. But yeah, if patients have any, you know, additional questions, I mean, they can always contact us by the agency email. But I'm just wondering if the ServiceNow team can offer any additional support or not. That's something that we have to ask the agency what kind of help we can get. And thank you for all the comments and feedback. And I agree that if we can make the survey shorter, that would be great. And that's why I'm meeting the board members one-on-one to see which questions are essential. So I appreciate all the, you know, adding more questions, but it may or may not be added just because, yeah, to keep the survey succinct, we just have to boil down to what's really necessary or not for board members to vote on what the affordability of the drugs. So we'll see on the length of the survey. Yeah.
Yeah, and if you guys have recommendations on, you know, questions or things that you think, you know, could be taken out, you know, by all means, please send those to us, and so we can use that in our deliberations as we're working on this. And the other thing is too, is I think that these surveys are kind of going to be living documents. So, you know, this is not the one final end all be all survey. So, you know, as we're, you know, moving through and developing the drug reviews and the programs, you know, we can refine things and see what works versus what, you know, maybe didn't work, and you know, every go around get a little bit better. So yeah, again, really would, you know, if you have specific feedback, have things that you would recommend for us in terms of, in addition to what you've just shared. Definitely looking forward to hearing back so we can try and finalize these surveys here, really in the next couple of weeks. So by the end of the month, have something, that we're posting and we can get comments on. So, okay, Marina, did you have
Yeah.
any other things to take us through here? Okay.
Yeah, I think we can move on to the expert survey. It's kind of similar idea here, but this is just targeting the medical field experts. But the structure is very similar. It's starting about the demographic questions in terms of where do they practice? Do you provide care for patients in Washington? What is your credentials? That kind of questions are in the first block. And then the practice setting questions. Are they primarily practicing in outpatient, primary care versus specialty care clinic? And what type of patients they usually see in terms of the insurance coverage, 340B covered entity, yes, no. So those are the questions kind of asking about their background. And the meat is here for the affordability questions. Have you ever recommended the drug? Yes, no. And any hesitancy recommending it due to the financial burden. And we'll be asking some questions on the alternatives as well. And then very similar idea, like what is the percentage of patients like not taking the medication or having some difficulty adherence. So it's just phrased in a different way, but it's asking a similar concept to the patient survey here. And actually, we try to include the questions regarding the insurance coverage or some administrative burden in terms of like step therapy or prior authorization. But the board members mentioned they know these are pretty high in those administrative burden, those of step therapy or prior auth. So we don't need to. So we can just remove this question because they know it's high. So it's just one way to make the survey shorter. And then the coupon use and patient assistance program use. So these are, again, similar questions to the patients, but it's just different tweak targeting the medical experts. And then the last one is, again, it's going to be the free comment question to get their input. So I think the structure overall is quite similar to the patient survey. It's just phrased a bit differently for the medical experts. And Tim, I see that you have a hand raised.
Yeah, and maybe just under practice setting, I think a key access point for these drugs is through specialty pharmacies. And I don't know, it's got a outpatient clinic, outpatient specialty clinic, acute care hospital. It doesn't have pharmacy. And then under the insurance portion, it might be good to clarify if we're considering Medicare Advantage plans as part of Medicare or under the commercial insurance, or just call them out separately.
Okay. And I also see a hand from Daria.
Thank you. Just to add on to the previous point about insurance type, particularly for the patient insurance, it's probably good to say Medicaid, AppleCare, or, because a lot of patients don't know that they're on Medicaid. And then my other question was right where you are, where you start the survey with the condition, and then move to the reviewed medication. Is the condition going to be a drop-down box filled in? I forget, by staff or how will doctors know what you're talking about? Because there could be a lot of conditions for one drug.
Oh, yeah. So this one is kind of generally formatted for whatever the medications the board is what's gonna be selecting. But it will be filled in with the applicable conditions or indications for the drug
Right,
that's going for individually. Yeah.
Right, but some drugs being reviewed have many conditions that they're approved for.
Yeah, so we might say for indications approved for drug XYZ or just depending on if it's a long list or short list. Yeah.
Okay. Thank you.
Yes, Tim?
Yeah, under practice setting, it lists 340B. What's the basis of that question for the survey? What are we trying to get from that?
I believe I forgot I think it's in Maryland. They have a separate survey for providers practicing in the 340B setting because it's just the patient population is quite different and it's kind of same thing with how the drugs are covered. But we are not doing two separate surveys, so we are just trying to do subgroup analysis by asking this question.
So what are we going to do with that information, I guess?
So we can look at the patient. I guess let's say if we are looking at one of the affordability questions, and let's say they put some certain percentage of patients not starting the medication, and then we can try to figure out whether it's higher in the 340B entities or not.
On that point, if you're going to be asking if the provider is in a 340B entity location, then consider asking them whether they provide the drug at a sliding scale for uninsured patients.
Okay, and any additional suggestions, questions? And I think we need help also on like distributing the survey here or like brainstorming. We are hoping to get some mailing list from the licensing boards, but if you have any additional creative way to outreach to the clinicians, that'll be some area that we need help to make sure that they are aware that survey is going on and we need their input.
Just one final comment on the 340B. If we're going to ask about 340B, you can only access 340B through a hospital outpatient, eligible hospital outpatient department, which goes to the practice setting question, which really speaks to just acute care hospital, which unless they're an outpatient, they're not going to be subject to 340B. And then the outpatient primary clinic, outpatient specialty clinic generally wouldn't be HOPDs. So I would just maybe add an additional category of hospital outpatient department if we're trying to get more clarity on the 340B. And if they don't check that, but they check 340B, then there's a disconnect between eligibility for 340B.
Okay, that's helpful. I just don't know what kind of logics we can build into this. But yeah, we'll see if we can build some logic to make sure that the response is kind of making sense with different questions.
But they could be at a primary care clinic and be 340B as well.
Right.
No, they can't. Not unless they're Not unless they are a hospital, an eligible outpatient department of the hospital. They can't be in a primary care clinic unless they're registered.
FQHC, I mean.
That's true. I
I
think
mean,
that's where,
I was considering an FQHC under a
Okay.
primary care clinic, but maybe that needs to be, if you're
I think-
going, yeah.
I think you're right, Daria. There's a lot of
Yeah,
ambiguity
yeah.
in 340B
That could be the
status.
primary
So,
care too.
and maybe it's out, yeah, FQHC needs to be a category under practice setting.
Okay, I think this this is everything I wanted to cover and want to go over with you. But again, if you have any specific like way to ask questions or suggestions that we can incorporate, that'd be helpful. So please email Simon and he'll pass the suggestions to me. So that'd be helpful if you could do that. Okay, Mike, I think that's it from my end.
Great. Okay, well then that takes us here kind of to our last piece of what we were going to chat about here today. So as we're putting together these patient surveys, we're also finalizing the forms that we've been working on for the past couple of months and getting ready to send those out. And so basically we're going to be collecting data 3 different ways. We're going to be pulling our own data from like APCD or FDB to gather the information that we can gather. We'll be sending out these patient surveys and working to get that feedback, as well as then sending out the forms to the manufacturers, PBMs, wholesalers to get that information as well. So once we send all that out and start collecting the information here over the next month, then we'll have all that and we'll start putting it together into a report. And then so the next big question is then, I guess, and I'm just kind of, we're putting it out here brainstorming, so I don't have any firm answers or definitive battle plan, but looking for ways that the advisory group would like to participate, to look at this information, where they think input from your level and your perspective would be best. So just kind of opening that up, and we don't have to come out with all the answers here today, but just something to think about, and then we can discuss a little bit more here at upcoming advisory group meetings, especially as we start getting new people on board. But I guess having never done a drug review here in Washington before, and every state does their drug reviews a little bit differently in the PDAB world. I guess how do you or where do you and when do you feel like would be key points that you would like to give input as we go throughout this data collection and compiling it for the actual drug review process? And just kind of opening it up for thoughts. Again, don't need all the answers today, but something to think about.
I have a thought.
Daria?
I don't know if when you're asking about like where in the process, do you plan to create an outline framework of what a report might look like and then kind of fill in for each drug? That's the way that Oregon has done it, and it could be useful to receive input on the framework first on how you plan to arrange the report in general.
Yeah, and Marina's already started putting that together, based on what other states have done, and this general framework has been kind of informing the information that we're looking for. So yeah, and I wouldn't say it's polished, but Marina, thoughts in terms of that?
Yeah, so we'll just follow the outline that was presented earlier. It's just data is coming in from different stakeholders. So just depending on the order we receive, the ordering of the outline might change, but the content is there. It's just filling in each section based on the input from the stakeholder, and we have to, of course, verify and may have to polish and may have to adjust the language to make sure it's appropriate for the board members and the public. But yeah, I think we'll just follow the outline that we went over earlier, because the stakeholder information templates and everything, that's based on that.
Sorry, we're talking about the actual review report. We already saw a framework. I'm not remembering that. Or are you talking about the stakeholder input?
So earlier on, and Marina, correct me if I missed anything here, but we, early on, we'd ask the board members, what's the kind of information that you would like to see, and so we use that to help build the rest of this. Of okay, so in order to get this set of data points that they want, here's the things that we're going to have to look for, and we can definitely share that again with the advisory group.
Thanks.
Marina, does that sound okay?
Yes, thank you.
Okay. Jim?
I know there's other information that's being collected for the affordability review, but the RCWs also state that the information is collected by the board is confidential, and so it's not available to the advisory board. Is that correct?
I would need to go and look at like the specifics, because the confidential information that we received. So the way we defined information, and again, we were working on this confidentiality stuff like over a year ago, so I'm a little dusty on exactly what falls where. But anything that was like publicly available or that could be found publicly, yeah, via like a subscription to, FDB or things like that, we weren't defining as confidential, if I remember how we worded that. But that, any confidential manufacturer data that is sent, that will be kept within, like the closed board sessions. And I can't remember exactly what the limitations were on with the advisory group. So it's not open to the confidential information definitely isn't open to the general public. But I would need to go back and double check in terms of how the advisory group fits into that. So I can't give you a definitive answer on that right off the top of my head.
Okay, that's fine. That'd just be helpful, I think, for the future when we're in the midst of the affordability review a little further.
I believe any confidential or proprietary information submitted by the manufacturers or any stakeholders will be only discussed in the closed session during the board meeting. So I don't think they're going to be available to the advisory group members. Being that said, any information that's open to the public will be open to everyone. So those are the information that we can discuss with the advisory group members, but not the confidential information.
Great. Yeah. Thanks, Marina. And we'll triple check on all of that just to make sure we cross our T's and dot our I's. So. Okay. Any other thoughts? And so just general things that I was thinking here off the top of my head is as we get data in for each of these different sets of data collection, maybe coming and having advisory group meetings where it's like, okay, let's talk about the survey results and let's talk about the form, the data that we collected from the manufacturers and the forums, or let's talk about, the general overall, data that we're pulling internally. So I think we can have kind of group sessions where we discuss that, get feedback, thoughts in terms of, recommendations that the advisory group may have related to specific sets of data as the board is looking at the report and making decisions. And again, I'm just brainstorming here, so I'm not saying this is the only way, or this is just a possibility. So open to feedback, and again, how the advisory group thinks they would like to participate and look at this. But that was kind of just some initial thoughts off the top of my head, is getting feedbacks or having feedback sessions on each of these sources of data as we're working them into the drug report. So, and Ronnie, did you have any questions, comments?
Well, I can't raise my hand. That function is not allowed on my particular link. But I think that these are important questions, and I think we do have, or I would like to see the Healthcare Authority do a further outreach to attract more patients, more providers. We've talked about some possible anecdotal or minor ways of doing it. I don't have any brilliant ideas, but it seems like we should be trying to do it and finalize it in a shorter period of time as this is like not going to pull in the candidates that we really want, the providers or patients or advocacy groups. I think we need to stretch it out a little bit, and I don't know how to reach out to people. Tim mentioned going to specialty pharmacies, but so many patients get their medicines directly from their provider. Daria mentioned the importance or the questions about pricing. I think patients are totally confused about whether it's the actual cost of the medication or insurance payments. And I think it's difficult for a patient to join into this conversation easily. I don't know what the answers are for finding more patients, but it seems to me that both providers, we need the Healthcare Authority should be doing more, find a way to do research or to reach out to more providers, to specialists, to more patients, and to patient advocacy groups. I think many of us, or some of us, have contacts with advocacy groups, but I think this might be too short of a timeline.
Well, and we still, in terms of time, the hope is that we can finish up, our internal feedback of the surveys here in the next couple weeks. But that doesn't mean we're sending them out or requiring patient response by then. So we still have time, and that there'll definitely be opportunities. We have more runway in terms of being able to do that outreach and wait for patient response. So I think we still have some wiggle room in terms of being able to make those contacts. That being said, just chatting with other states as well, even with a decent amount of time, surveys under the best of conditions are hard to get people to fill out, and then especially trying to find specialty, a specific population and outreach to them and get them to fill out the surveys is difficult. So either way, I think it's going to be a challenge. And again, I think this is going to be kind of a living learning process that hopefully will continue to get better and better as we go. But yeah, I definitely agree with you, Ronnie. Needing to make sure we cast as wide of a net as possible and give people the opportunity to do that, reach back to us.
So what is the milestone for 2 weeks that you address for 2 weeks?
So wanting all the internal review here and feedback, so that way we can post it to the web and put it out there and allow for public comment as well.
I guess I was a little confused by you saying that there are so many people we've had 2 providers and 1 patient apply. So this the timeline is not.
that's for the advisory group position. So we're also doing outreach to get specialists to be on the advisory group to, to add additional members, related to these specific drugs that we're doing the review of.
Yeah.
So that's where we've been doing that outreach. And we were soliciting feedback of other ways to find additional members for the advisory group. But the survey is a separate topic, which I thought is what you were talking about, was finding ways to reach out to those patients to get them to respond to the survey.
And it was.
Okay. Yeah, so we got a bunch of things going on at the same time. We're busy. Okay, great. Any other thoughts or comments on just kind of the general path forward then? Okay. Well, I appreciate everyone's time. So unless there's anything else from the wider group, that's kind of all I had on my agenda for today. Okay. So I think just thank you everyone for coming out here. We got done about an hour early, which I know I always like ending meetings a little earlier if the opportunity arises. So again, thank you for your participation, and thank you everyone else who wasn't part of the advisory group for listening in. And yeah, we'll keep you posted. Like I mentioned, we got a lot of things going on, expanding the advisory group, sending out forms to manufacturers, outlines for the drug review, patient surveys. We're doing a lot. Oh, Daria.
Sorry, that just reminded me of my other question. Do you plan on recirculating the updated manufacturer data request form?
Yeah, we're gonna post that here once we get it finalized to the website.
Okay, thank you.
Okay, well then everyone have a fantastic rest of your Tuesday. And again, always feel free to reach out if you have any specific questions. Thank you so much.
Thank you.
Thanks.
Thank you.